Hello. So for today's module, we'll be talking about health risk assessment as well as community health risk assessment. If at this point any of you is wondering whether they are the same thing or if there's any connection between them, my answer would be not really. Both assessments basically tries to understand the different people who are being assessed in terms of population, in terms of individual, just to know what type of programs it has to be designed that would help meet their needs. Health risk assessment is more individual. It's just basically assessing the health risk of an individual. Community health risk assessment is more or less like looking at the needs of a population. In this case, the community is being used as that. So they are not the same and they don't really have a connection between each other, but they are tools that we use in understanding the needs that an individual, a community needs, so that we can come up with the best health intervention for them. So that said, there are three learning objectives for today's class. We're going to talk about the concept of risk assessments, talk about risks, talk about risk score segmentation and stratification. Basically, at this point, I'm just going to define them more than anything else, and then we're going to identify the basic five segmentation categories that we have. And then lastly, I'm going to describe the purpose of community health needs assessment. So we begin with the health risk assessment, talking about the concepts. So one of the things that is very very significant when it comes to population management is that we need to understand what's going on, and there's a lot of data that is used in population health management, and basically our understanding of those data, being able to adequately collect those data, help us in really tailoring interventions that meets the need of a population or an individual. I think it was in Module 2 that we talked about, Module 2 or Module 3, talked about segmenting a population. Because if you don't segment the population, you may end up designing programs that are not a good fit for a population. You don't want to just have one population in mind and make assumptions about what those population need without, basically going deep and really understanding what's going on with them and all the social determinants of health that are in place, that is leading to the results that they're getting with their health. So that is where these assessment tools come in very handy, because it does help us to better understand the individual or the population, so that when we are coming up with health interventions, health programs, we know that they are being targeted and will have the desired outcome that we want. So when we think about in terms of risk, basically in a way it's just the typical way you understand what risk is, but in this case we're kind of thinking, what is the chance that something would happen? You would understand, in businesses people are trying to, I think they call it risk mitigation or something like that, trying to think when it comes to lending money, something like that. So banks look for someone who they think they're likely going to pay them back. So they're looking for the chance that this person is going to pay them back. So the risk they're trying to avoid is where someone is not able to pay back the loan has been taken. So in the sense with healthcare is basically we're trying to look for the chances that a health event or adverse effect is not going to occur either for an individual or for population. Basically we're trying to avoid that. An example would be hospital readmission within the next 6 months, which there could be so many things that that leads to the readmission, one of which is not complying with medications and things like that. So you really want to be, envisage those kind of risks and do things to make them not come about. So another term that is also used is things like risk factors, and in this case, it's just looking for exposures that are associated with a disease or a condition. Let me use, for example, with diabetes. I think one of the things that diabetes people need is being able to exercise properly, so that and being able to have treat their legs if there's things that are coming out from them. So we know that someone who has diabetes, there are all of this potential complications that will come out of it for you. A poorly managed diabetes. So we know that this is all the exposures in this case, and we're trying to, okay, what is this person's risk factor of developing these complications in terms of, the food that they eat, in terms of, whether they're able to, take their medications on time and consistently take it. So those, all the things that we need to think about in healthcare situations. Another term that you hear is risk score, and is basically with risk score, just kind of putting numbers to what is the likelihood that this is going to happen, or this is not going to happen. And then after you have with this risk exposure, risk factor, risk score, we then use all of this in trying to segment, population in terms of who is going to be potentially high risk of having this event happening, and who is low risk of having the event happening, and who has kind of a medium. And so when we come, when you're trying to determine who is high risk or not, a couple of things you need to take into account. You're looking at their current medical bills. If someone doesn't have good insurance and the person doesn't have, high income, and you're thinking about putting them through, you kind of suggested this is the treatment that they need, and that's going to cost a lot of money. It is very unlikely that this person is going to go ahead and do that treatment, because they don't want to be left with, thousands and thousands of dollars that they cannot pay. So those are the common things you want to kind of think about. Also considering the social determinants of health. Let me use, for example, if someone has to probably have to go to a different county or a different state to receive a treatment, maybe because there's not so many medical professionals who are specialized in something like that. The chances of that happening, depending on what their social circumstances are kind of low. So you want to think about this, because if you don't think about it, you're kind of not planning for the things that might happen, of which if you don't plan for those, you will not be able to prevent them from happening. So which is kind of risk segmentation and risk stratification are things that we do as part of the risk assessment. So they all come close to, you do the risk segmentation first, and then you do the risk stratification, and just basically helping to identify the patient's risk level related to whatever risk factor that you're using to measure it. With the goal being you want to match, the person with the right intervention, the people who are going to require, let's use, for example, more preventive treatment or more preventive interventions, and people who are going to require more complex interventions or more complex programs, and may have to look for other ways to help them in paying the hospital bills that might come out as a result of those complex interventions that is needed. So you want to be able to identify them in order to make it such that you have those optimal healthcare outcomes that is what is desired. So I just think I've talked about that. And yeah, I talked about this as well. Talked about this. And okay, so what comes with risk stratification is, the next step after you've, matched the intervention with the health outcome, is basically determining, okay, what are the healthcare needs. You will see when I talk about the categories that, you kind of put them in, that the needs of the healthcare is going to change depending on whatever category that the person is. Some categories are not going to require care coordination per se, because it's probably going to be those kind of one-off things, or you're probably going to see them like once a year, and stuff like that. I know that people who do the mammogram and then tell you come back in 5 years. With people within those low risk, you're not going to really put in a lot into care coordination. But people who are at high risk of breast cancer, you're going to have to kind of do a little bit things into a care coordination because you know they're going to need it. Possibly sooner. You're not going to say, "Oh, let's see you in 5 years," and stuff like that. So you want to be able to correctly identify who goes into what, and be able to make sure that there's been provision made for the services that they need. So now we're just going to go into those categories. So I have included this people well sourced in the assigned viewing. I also included their sample survey and how they do their risk assessment. They have a couple of information that really helps you to honing on in understanding, what it is that this risk assessment goes into, what kind of data that they're trying to get out of it. So if you click on this, it will take you to a document that really goes into explaining risk assessment, why it's done, and how they get that done. You can just click on it to take you to that source, and so the risk assessment questionnaire, or it's called risk appraisal. It basically has a number of questions that is used to help in identifying which category that you fit in terms of your risk profile. So the information that is collected, includes a lot of things, biometric testing sometimes, and then it has, information about your personal health status, your habits, and stuff like that. But those alone does not, just having the risk assessment done does not mean that, everything is all good and well, we're able to cut costs. It's just that you're going to have to do that in addition to other things in terms of, let's just for example, for people who are kind of on the preventive side, you may want to focus on trying to shape their lifestyle choices to promote preventions. For those who are going to require more complex intervention, then you know that we have to really get them to the people that they need and do that quick enough. So these are some of the steps that is taken with the segmentation and stratification. You want to first of all identify the priority population. Usually at this point, when we talk about priority population, a lot of the times we are looking at people of high risk, people who are most likely going to have this event happen for them, or it could be people who are going to be most impacted if they have this event happen to them. So, you just kind of want to look into, make sure, you identify the priority population, because healthcare costs a lot of money, and we kind of want to be careful when we're spending and want to put money into the places that is most needed. And after we have identified the priority population, we now have to understand the needs of the people within that population and what their risks are, and then we have to kind of stratify it and predict, okay, how is this person going to be in terms of risk in the next 6 months? How is it going to be in the next 1 year, and stuff like that? And then from there, you get evidence-based interventions, and then implement that, and then finally kind of measure to be sure, because sometimes we have good ideas of what is going to work, but after it's been implemented we find out not so much. So then you have to kind of make changes, make adjustments, and stuff like that. So that is all the steps that goes into it. But so the whole process is, you want to have a patient segmented, then you do the stratification, and then you do the public population health management intervention. So all three of them has to happen to have a well done risk assessment. So we may be focusing on segmentation and stratification at the questionnaire side of it, but appraisal side of it, but that's not where it ends. We have to have the intervention part of it, just kind of making sure everything matches. So this is the risk management category. You have lifetime management, and with people who are here, we're kind of very much dealing with low risk people. So we kind of want to make sure that you're kind of okay, stay in the straight and narrow. Then we have demand management, disease management, and then we get to disability management. With the disability management, you can imagine it's more complex, and you're also having to deal with critical things, and they may be requiring, there may be a lot of money that is being spent here. But another thing to realize is that just because somebody is in lifestyle management doesn't mean that they're not going to get into disability management. You may kind of move, but just being aware that just because someone has, today's lifestyle doesn't mean they're, always going to be there. There may be other things that happen, and then suddenly they jump into disability. And in terms of other things that happen is COVID happened and turned the world upside down. And so we know that things sometimes unpredicted happens, and then suddenly people we thought were not so much doing terribly, things just kind of happen. So just kind of pay attention to that. So there's a couple of definition of what those different categories are. At this point, you can just pause it and read that up. And that is for catastrophic disability management. It kind of explains what those are. So finally, on learning objective 3, we're going to talk about community health assessment. So with community health assessment, it's kind of similar with the risk assessment, but in this case, the risk assessment it has looked at events, usually a not so great infection is happening, and it's trying to avoid that event from happening. With community needs assessment, you kind of there is already a problem that is happening right now, and we're trying to find solutions to it. But you cannot design a solution out of thin air. You have to be able to understand the needs of the people for which you're going to design the solutions for. For one thing being that you want to design a solution that they're going to be okay with using, they're going to accept to use, and not just when they accept it, but they're going to use it still as long as they need to. And because you're not going to fund that intervention for the rest of their life, you want them to be able to have ownership of it. It has to be something that they will buy into, so that even when you and your money and your organization kind of leaves the scene, they may still be able to continue it. You want to, this is for example, bring in the lifestyle change. The plan would be maybe to do this intervention for 1 year, 6 months, but the plan is that after you've done the intervention, you're going to leave. But that doesn't mean that after you've left, the lifestyle should, revert back to the way that it used to be. So you need a buy-in of the organization to be able to do that. And therefore, you need to make sure that what it is that you think the community needs is actually what the community needs. And so assessing the community needs requires that you kind of address select needs. Again, people are going to hear me say this a lot of the times. There's only so much money that's around to spend, so you want to make sure that whatever money that you spend it in what has the most impact or addresses the most need. So if you click on this link, it will take you to St. Joseph Hospital, what their 2021 Community Needs Assessment did. It will kind of help you to picture it, how that happens in real life situation. So what does a community needs assessment does? It identifies and prioritizes the community health needs. It focuses on the community, not just individual patient needs, which, we've kind of, with population health management, we're thinking beyond individuals, we're thinking more population. So that is, basically, how that goes with community needs assessment. It collects data, and a lot of those data we're going to have to collect it on social determinants of health, and then it does reach consensus in terms of coming up with a strategic plan that is going to be done, what that plan is going to be, what that intervention is going to be, how that intervention is going to be implemented, and how it's going to be assessed to know that, okay, this is what we plan to do, but did we actually do it? And we did it, but did it have the outcome or the impact that we hoped for that to have. So you need to have all of those, put into consideration, in implementing the plan and all of that. So this, all of that, everything that I said, this is just it in a table form. Clear definition of the community that is being served. You need to then have when you're all done with everything, have a report of it for audit purposes and everything else. But basically, just go through this requirement, and this is a process of the community health needs. You have to identify your stakeholders, schedule meetings. Generally going to require a lot of meetings depending on what that population is. And if it's a community you're unfamiliar with or you're not from that community, you're going to imagine you're probably going to have a lot of meetings with with the people who are in there, because you may have a lot of learning to do about the community, the social structures of the community, the social norms and stuff like that. So you really want to, take time to understand. You also have your data collection and analysis. You want to make sure that your data collection is one that's, kind of in sync with the community. That is one that they will be comfortable with, and then at the end of the day, you implement it. So that's it. Some of the questions to ask when you are thinking about coming up with the community health assessment is: who is your geographical, what's your population, what's your community, who will be part of it, in terms of both who is going to be the people you have that discussion of what to do, and both those who are going to be the beneficiary of the intervention. What is a need and what is a want? How do you prioritize the community needs? Who is responsible for what? You want to make sure you know that. What strategy will be used in implementing this, things you come out, whatever smart decision plan that came out of, who is going to be the one to implement it, because you don't want it at the implementation point to be where the failure is kind of introduced. And then finally, return on investment in terms of impact, health impact. For an example, like a lifestyle change intervention after you have pulled out of the community, that good lifestyle continues after you are all done with that. So that's where we end for today's class. Please use the Q&A board if there's any part of the lecture or the assigned reading and a viewing that you kind of need more clarification on. Do have a lovely day. Bye.